Well, welcome to the webinar, everybody. I'll just introduce myself. I'm Nikki Edge. I'm the Executive Manager for Health Design, Innovation and Integration with the PHN. I'm going to turn my camera off shortly so that you can just see the slides. I think it's easier for you to follow those on screen. So we'll just do that. And as we go along, I will introduce you to other key speakers that we have to support us this evening, and if I can just ask you to stay muted while we go through this presentation, that will make it easier for everybody to hear. Okay, I'd just like to acknowledge country. So country, as a PHN, would like to acknowledge and pay respects to the traditional owners of the different lands on which we meet and pay respect to their elders past and present. We recognise the significant importance of their cultural heritage, values, beliefs and self-determination in contributing to the positive health and well-being of the whole community. We also recognise the diversity of nations across Australia and extend our respect to any Aboriginal or Torres Strait Islander people present today. And just reminding of housekeeping, as I've already mentioned, if you could please place yourself on mute, that would be great. Please also use the chat function if you have any questions. We will aim to answer any of these at the end of the session if there's time. Alternatively, we will send all responses to questions out to anyone who attends us this evening. We'll try and have an opportunity at the end of the session for questions if there's time. We will record this session so that all of the information will be available subsequent to this webinar. All right, now I've already mentioned myself as the host this evening. We've also got Kirsty McLaren online, who's the Senior Project Manager for Rural Support Service, and she'll talk to you a bit more about the ICCNet remote health monitoring and the Health Pathways team. We have Litsa Myers, who you'll see later. All right, the session purpose this evening is really just to highlight the PHN's role in aged care and our commitment in this space to talk about and remind people about some of the key initiatives that we have on early intervention and after hours. And then talk about some opportunities for training and support and you know, where we can assist going forward. So our commitment, well, that's to support the aged care and health sectors, practitioners, staff and community to enhance access, integration and coordination to primary care and other health services so that we can support better health and wellbeing of our senior Australians living in South Australia. So an overview then, as part of the Australian Government's aged care reform package, we've been working with the health sector, you know, and practitioners to improve access to primary care and other health services in the aim of reducing avoidable hospital admissions for senior Australians and to enable care and support at home or in the appropriate care setting. Some of you may have heard already about some of the initiatives that we have in place. There has been a number of webinars and other communication forums. Hopefully today we can run through the key initiatives that we think will be of benefit for you this evening, and that's about access to telehealth care for aged care residents, our early intervention to support healthy ageing and ongoing management of chronic condition initiatives, a little bit of information about the after-hours support for residential aged care, and then we have our Health Pathway colleagues online who will talk to you a bit more about the work that's going on in that space around the aged care portfolio. All right, access to telehealth. So this is the first of the initiatives we wanted to give you some information about tonight. This is about assisting country SA residential aged care facilities to establish telehealth facilities and equipment to enable their residents for virtual consultation with their primary health professionals. So there are telehealth support grants available to support the costs associated with establishing suitable telehealth solutions and models of care. These grants went live on the 1st of September, and facilities can request requirements to support purchasing of the technology that they need. There will be support for participating centres with relevant telehealth training and education opportunities. We'll talk a bit more about that towards the end of the webinar. The grant facilities are available up until June 2023, which allows facilities that are perhaps unable to participate right now to access and apply for the grants later. And you know, we are really encouraging facilities to join in and access the grant that's available. In our early intervention to support healthy ageing space, we have a number of things in scope. So implementation of targeted interventions which prevent, identify and reduce chronic disease and health issues. The idea again is avoiding inappropriate hospital admissions and improving health outcomes for the aged population. We have initiatives that support collaborative approaches between multidisciplinary teams and primary care providers, and initiatives that educate family members or carers on how to manage an older person's health. In 23-24, and we are planning for those initiatives at the moment, we want to expand our focus to look at some of our more disadvantaged or complex populations, and also to look at the younger age range and focusing on healthy habits and other prevention initiatives, around obesity and other chronic conditions, which help support, our younger population and with their longer term health needs. The other area that we're focusing on is also around engagement with schools and the education sector. So the first of the initiatives is around our aged care tele-support service. This is run by COTA SA, and this is a statewide tele-support service which assists older people living in country SA to navigate the aged care system. So finding social supports, receiving aged well information and connecting them to local services throughout country. The Better for Life initiative, which is run by Southern Cross Care SA Northern Territory, has expanded their online exercise program for 65 years and above in the Barossa Hills, Fleurieu and Kangaroo Island locations. And this also now includes a multidisciplinary team of allied health services, including a dietitian, occupational therapist and social worker. And what this expansion will enable is early intervention and chronic disease management resources for clients and their families to promote disease awareness, healthy behaviours and ways to minimise chronic disease and symptom management. Again, initiatives focusing on early intervention and chronic disease management. We have Dementia Australia, who've expanded the Nightingale programme, and this now has face-to-face nursing services in regional areas, which incorporates occupational therapy services. Outcomes will see around 200 or more people aged 65 and above and their families per year to have early intervention when diagnosed with dementia, supporting them to create a better quality of life, reduce the need for crisis care, manage their chronic conditions and symptoms, and when the time comes, die with dignity in their place of choice. The Arthritis SA initiative will deliver on an online exercise and wellbeing programme called Reboot Your Life, Living Well with Arthritis, again for older people living with musculoskeletal conditions across country SA. We'll focus on people in need of early intervention or at risk of deterioration whilst awaiting surgery. The aim is to optimise health and avoid unnecessary hospitalisation. The programme is hoping to see a target of around 170 clients or more, aged 65 or above, who will access the service per year. The other initiative we wanted to signpost was the ICC-NET virtual aged care support using My Health Pocket is our acronym. And their team is online to provide a bit more information about this. Well, this is a collaboration between the Rural Support Service, ICC-NET, primary care providers, which has been delivering chronic disease management for some time and more latterly COVID remote monitoring programs, assisting GPs, practice nurses and clinical decision making across the system and avoiding hopefully hospital admissions. Building on the successful model, we've now expanded this into the aged care setting, and I'm going to hand over now to Kirsty, who will talk to you a bit more about some of the work that's already happening in this space and the expansion.
Yeah, thank you very much. Thanks for PHN for A, your funding, and B, for inviting us to share our program with everybody who's attending tonight. Yeah, so our program combines two successful programs that we already have in existence, one for chronic disease monitoring and one that grew out of that for COVID monitoring. So the little workflow chart that you see in front of you now shows what we've been doing in the early stages of this program. We've been rolling out our COVID home monitoring kits into aged care facilities so that they're there on site ready to be deployed as part of an outbreak management strategy. So the kits can be, when an aged care facility comes on board with us, we pre-enroll all of their residents onto our database so that all of the paperwork is already there. They're sitting there ready to go. In the event that they do have an outbreak, they can immediately deploy one of the kits that they've got on site to any residents very early, as soon as they've showing the signs and symptoms of that COVID. What that's meant for aged care facilities that we've had participate already in that program, some of the feedbacks that we've had is that it's been great having individualised equipment for those residents to be able to use. It's improved their infection control, not having to move vital OBS monitoring equipment from room to room. It's provided an extra set of eyes with our nursing team looking at those results and helping the team on the ground who often are impacted with staff off with COVID as well. So the way that model works is once we get acknowledgement from the facility that they've rolled out kits to patients, we rapidly get those activated onto the kits that they've been given. They do an interview process via technology. Although our equipment is originally designed for use by the person being monitored themselves, with the aged care facilities, the model is slightly different in that it's a staff member that's assisting the resident to undertake that monitoring, because most of them are unable to do that as an independently. So it allows personal carers, assistants and enrolled nurses to actually go through that process with the resident, take their observations, and then the results are uploaded directly to our database where they are reviewed by our registered nurses, and they're also available for registered nurses in facilities. So you get when the participating aged care facilities get their own individualised log-on, and they can have full visibility over all of the observations being collected from their residents at all times, and access to their charts of all of those observations longitudinally over time, and can print and generate their own copies of those observations as well. So the main things that we have in those kits are a pulse oximeter, a blood pressure monitor, a thermometer, and the tablet technology, which collects all the observations from the peripheral devices via Bluetooth into that central tablet, and at the end of the process those results get uploaded to that database, which are then monitored and accessed. We have very clear escalation pathways for those residents being monitored by our registered nurses. They will get in contact with registered nurses in the facilities immediately if there's any results of concern, and discuss those. But as a matter of course, we also do a daily handover, which is in the form of a written handover sheet that is filled out in consultation with the registered nurses, and that summary gets saved on our database. From the acute side and the COVID management program, once we've rolled that out, we also then review the residents list that we've been given to pre-enroll into our database for the list of chronic conditions that we're looking to monitor over longer term periods, to try and help get a kickstart on, or heads up when there may be any deterioration of those chronic diseases, and allow for earlier intervention. So we interact with the aged care facilities regarding residents that could possibly be eligible and come on board for the chronic monitoring. We've so far successfully worked with several aged care facilities that have had outbreaks with the acute side and the COVID side, and we're just engaging and getting our first patients on to the chronic monitoring at the moment, and we hope that they will go live in the next couple of weeks. So the program's tracking along quite well. The other thing I perhaps should mention feedback that we've had from facilities that have been participating in the program so far and have undergone the COVID outbreaks is that they've been able to have access to that telemonitoring that's on the tablets, the equipment that's in the residents' rooms as well. So not only do they have their own set of equipment that stays with them throughout their monitoring period and for a few weeks post-infection, that equipment is also fully equipped with health with Health Direct on there, and so the GPs have full access to do consults with residents in their own room in the event that they do need to be escalated for additional support or care. That's probably a summary for you, and hopefully you might have some questions for me at the end of the presentation.
That's fantastic. Thank you for that. And I think, as you alluded to, in late October, hopefully we will go live with the 24/7 monitoring for GPs, so
Yes.
that will support our after-hours strategies that I'm going to talk to you about in a bit more detail now. And so that's the, as you can see there on the screen, that's the scheme, that program that you just heard about, and that will be expanding 24/7. From late October. So the after-hours support for residential aged care is an initiative by the Commonwealth, really to improve, I guess, and ensure that we have good after-hours planning across the state and in our rural and remote areas. And for residential aged care facilities that wish to participate in this, we've tried to map out on the screen for you there what engagement might look like and how we might be able to support in this space. This is a relatively new program that we're working our way through, but at the moment we're trying to understand existing plans and current policies that might be in place in different centres. And if residents have deteriorating health or require medical advice during the after-hours period, what currently happens, and then to try and help and work with our residential aged care facilities to help them develop plans based on the minimum requirements that the Commonwealth have set for after-hours pathway. And those are listed there in the table. You can see those, and we're happy to provide any further information as required. But it's really about, having appropriate clinical governance in place, workforce or access to workforce, the infrastructure and technology, which you've heard a little bit about today, to support that, and then what the systems and things are that need to be in place to help in times when those residents might have needs out of hours. There is some further guidance in the Silver Book, and we've put the link on the bottom of the screen there. But we are really, really keen to help and support any centres to have a look at how they might strengthen or develop an after-hours plan, and we're more than happy to come and meet and chat about that in more detail. We've identified quite a few facilities at the moment that do have after-hours processes in place, and what we're trying to explore is barriers to accessing care or skills or education requirements where we might be able to help bridge some of that gap. So again, more than happy to take questions on this or provide more support. And again, I put the link on there for more information. Now, I think now I'm handing you over to Lisa, who will talk to you a bit more about our health pathways.
Hi, thanks, Nikki. Thank you for the invitation to come and talk about health pathways. My name is Lisa Myers, and I'm one of the clinical coordinators with the Health Pathways program. I do work for Country SA PHN, but the Health Pathways program is actually a joint initiative between Adelaide PHN and the Government of South Australia Wellbeing SA. I'll be focusing a little bit on older person's health, but also just give you, this is really just a snapshot about the Health Pathways program. So what is it? What is Health Pathways? Well, it is a free online portal. It was originally designed for primary care for GPs and nurses, but we have expanded to allied health, and now we are very keen to look at what would make it really useful for aged care professionals, particularly in the residential aged care facility space. But the portal itself is clinical pathways, so that any health professional across South Australia has access to up-to-date clinical assessment, management, referral and local service options. So what's really unique about health pathways is perhaps a GP might have access to the therapeutic guidelines. They don't have the referral options. So if you went through a clinical pathway, at the end when it said referral, so whatever that referral option is, whether it's allied health or outpatients or mental health, then the referral options are mapped, and they are mapped across the whole of South Australia. We've just hit our 300 clinical pathway and referral page mark. So we've been going for 5 years now. And these clinical pathways are being developed on an ongoing basis, and they're led by South Australian GPs. This slide is basically just to give you a snapshot. So if you do have access, which I'll talk about at the end, how to access health pathways, that this is what it looks like. So the content is down the side. It's easy to use. You can put in any clinical condition, and hopefully it will be one that has been developed. As I said, we are developing them over time, and there is a real focus on older persons' pathways at the moment. So on the next slide, I've got some of the ones that we have already developed, which includes fall screening and prevention, frail but stable older persons, elder abuse and neglect, unexpected deterioration in an older person, and cognitive impairment and dementia. Now, this is currently under review because we review all clinical pathways every 3 years. So an updated version of that will soon be available, and also 5-minute neurological exam for patients with possible dementia. On the next slide is some that are coming soon. So this includes with dementia, behavioural and psychological symptoms of dementia in the older person's health before entering a residential aged care facility, carer stress and support, delirium, depression in older persons, restrictive practices, weight and nutrition in older persons, 75 plus health assessments, and over 55 plus Aboriginal persons health assessments. In the palliative care space, it says coming soon, but they are basically going to be published tomorrow. So palliative care patient, last days of life, advanced care planning, pain medications in palliative care, emergencies in palliative care, symptom management in palliative care, and also the palliative care referrals. So if anybody wanted to get some palliative care advice, then we have a website for that. So they will actually be released tomorrow. So that is really hot off the press, that information. So just to finish up very quickly is all we really want at this point, we will hope to be engaging and going out there and talking to residential aged care facility staff, is just to let you know that we're available, that it's free for you to access clinical pathways. That's the QR code if you're wanting to have a look straight away. On the Health Pathways website, we have a special username just for you, which is Residential Aged Care Facilities RACF Country. Password is SA password. If you have a look and you have any comments, if you want to engage with us, please email us at inquiries@sahealthpathways.com.au. And the project site's got a little bit more about the project, and is also, if you forget the username, that's where you can register for use. So if you've got any questions at the end, very happy to answer them, and hopefully you will be hearing a little bit more from us. And thanks again for this opportunity just to give you a little snapshot. Thanks, guys.
Thank you, that was great. The final slide, I think, from us is really just about some of the work that's happening in terms of training and support, and where you can access some technical support. So any of the facilities requiring technical support to establish their telehealth virtual consultation systems, or any facilities that already have this but are not currently using it particularly well or need some support with that, can be provided from our IT support team. In addition, we're developing an education package, which is hopefully coming in the latter half of this year, through an external training provider, but it will include a plethora of things, including how to use the telehealth systems, and when and how to link to some of the digital information support services that we have available. So there'll be links in there to the ICCnet and different things that you've heard today. How to register and create the required accounts to access the necessary applications for digital and telehealth consultations. how to assist or will provide assistance in creating and implementation of an after-hours pathway for your facility, and where to get support for that, and how to implement and embed health pathways in your facility. So yeah, and it'll probably be, you know, those are the key things, and we want to engage over the next few weeks to make sure that what we build into that education package is tailored to support the needs of the region. So will be further information in that space. So we have no questions at the moment in the chat space. So we have about 5 or 10 minutes available if there are any questions. Once we finish the webinar, obviously we will publish that on our website, and all questions and responses will also be provided. So if people want to message us afterwards, or alternatively, you can send us an email at ageandwell@country.saphn.com.au. If you want to engage with us around any of the initiatives that we've talked about today, or in particular around, you know, the after hours planning, or to access a digital grant, then please contact us through that website. Okay.
Yep. Thanks for your question, Kate. Our program is totally free of charge to the facilities. Thanks to the funding of Country PHN, we can bring that to you free of charge. What we would normally do, the model that we've been using, is that we pre-allocate you 5 COVID preparedness kits to have in your facility ready to roll out. We can mobilise them quite quickly from our office in Adelaide. So if there is an outbreak, depending on how serious that looks, we'll actually get you more kits shipped out on the day that you activate that plan and let us know that you're deploying those kits for use with your residents. And then the chronic monitoring kits, the COVID kits actually get sent back to us, and they get go to professional cleaning after having been in a residence room with COVID. And we actually send out a new kit for the residents to use for the chronic disease monitoring. The chronic disease monitoring kits do have some slight differences in the peripherals that are used, because they have a more complex interview process that is more tailored to the chronic disease conditions, with some branching logic built into the questions that take into account the different requirements, or the different monitoring that's required for the underlying chronic health conditions.
Okay. I think there's no other questions in the chat space. We'll give everybody an early minute and just remind people that if you do have any questions, email us on that email address, and we'll happily respond or provide any information. Thank you again for your time tonight, and have a good evening.